Hey, Becca here, and today on ALifeLearned, I'm going to talk about the difference between OCD, that is Obsessive-compulsive disorder, and OCPD, that is Obsessive-compulsive personality disorder, in a response to a video about OCD done by Allison from Just Between Us, the YouTube channel.
Ideas are nearly as useful as what we do with them.
An idea could escape.
Ideas are bulletproof.
So I linked the video down below for anyone interested. Allison did a rather good video offering some suggestions on how those suffering from OCD can deal with it and try to cope. And I just wanted to make a comment on one of the things she said, but before I go ahead with that, I wanted to note that she said that she has OCD, Obsessive-compulsive disorder, and I actually have O.C.P.D, that is Obsessive-compulsive personality disorder, which are actually different conditions. So I just want to clarify that I'm not coming from the exact same position, but these conditions are related. In OCD, it's an anxiety disorder where the person has uneasy feelings about the compulsions and obsessions that they have to do. These things cause them a lot of anxiety and worry, and they have to do them, but they don't make them feel any better by doing them. They just feel anxious about it. Whereas with OCPD, that's actually a personality disorder, and people who suffer from OCPD actually see their compulsions and obsessions as desirable, and satisfying them makes them feel better. So in my case, like Allison, my OCPD is related to cleanliness and keeping my space organized. I'm very much about controlling my environment, but I feel a lot better in doing this, and I don't have repetitive things that I necessarily need to do. I need things to be kept in a certain way, in a certain level of cleanliness and organization in my control, and as long as it's that way, I'm okay. If it's not, my anxiety goes through the roof, and I get very unhappy, and I get obsessive about having to clean it. And a lot of the tips that she offers in that video are really very helpful in terms of anyone who suffers from OCD or OCPD in terms of coping with these conditions. So I do suggest checking it out. But one thing that she says about taking medication, I just wanted to comment on because I thought she left the subject a little bit too open. She, well, instead of telling you what she said, here, I'll just play it for you.
I think if you need medication, go on medication. Why not? I take Tylenol now if I think I'm going to get a headache.
Now, in terms of her statement of why not, there's actually a lot of reasons why you should think twice before taking any medication. Tylenol, as she said, it's relatively harmless. I mean, I wouldn't necessarily take it if I think I'm going to get a headache. I would take it if I do get a headache, but I'm sure that's what she actually meant. But rather, when it comes to more intense drugs, like they prescribe antidepressants for OCD, and in things like this, there can be side effects. Nowadays, they're a lot less often. They're very well-studied medications, and for the most part, a doctor will give you something that works for you. But there is a possibility of having to face side effects, and this is really something that you should give real consideration before you jump on taking a medication. Now, that's not to say don't take it if you need it. As she said, if you need it, it's a very good idea to take it. But if there are other options that you can consider, that's also a good idea. So the reason to why not is basically because that's adding a chemical to your body, a foreign thing, that could possibly have a bad effect. And so my response would be, why not try something that's not medication first? And then, of course, if you do need medical therapy, by all means, listen to your doctor and take something. Just definitely don't jump on it like it's Tylenol. Think twice and be careful, and then do what's best for you. Anyways, thank you so much for listening to this response to the video was called How Do You Deal with OCD? It was a question to Allison on Just Between Us. And I would suggest checking out their channel. It's pretty cool, and they seem like pretty nifty people. So anyways, I hope you enjoyed this and take into consideration some of the things I said. And feel free to comment below about any experiences you might have with OCD or OCPD, and any experiences you have with needing medication and taking it, and any decisions you might have had, or anything you might like to talk about towards those subjects. I'm sure anyone watching would really love any tips on coping if you might have them. So thank you so much for watching, and please join me again next week where I try again to share a little something I've learned in life.